How's it going, everybody? My name is Jesse and welcome to Male Nurse Mentor. So for some time now, I've been making videos slowly about correctional nursing. It's a series I've created called Correctional Nursing 101. Well, I really started creating this content when I actually left the correctional setting. That's when I felt most comfortable to speak about it, and I realized there isn't a lot of information out there on the internet about it. There's a couple Reddit posts, maybe a couple reviews about certain places you can work at, and maybe if you go onto correctional officer forums, searching the internet, you could find some information about what it would be like to be a nurse working behind the bars, right? And when I say this, I mean the jails, I mean the prisons. For those that know, you've been following this series, I've worked in both settings. I've actually been out of that setting for about 8 months now. So I figured I do want to continue to make these videos. I made this one specifically a Q&A. I'm going to answer 13 questions. 13 questions. I want to put them out there all before I forget, because the longer I'm in this seat here, the less I'm going to remember the actual details of what it's like to work behind the bars. So if you're watching today's video, sit back, relax. Also, use the timestamps down below as a reference. Jump around, see what questions I'm going to answer, and maybe just click on the ones you're most interested in. And of course, friends, as a lot of you have done already, reach out to me via email if you have any additional questions. Follow me on Instagram, send me a DM there. Those are good places to reach me if you have any questions at all on correctional nursing. So friends, this first question, I got my phone here, as you guys know I always do. Can a new grad work in corrections? Well, I was a new grad and I went to go work in corrections. If you're trying to avoid the hospital, that's not your place, the hospital's not your thing, going into corrections is a good way to avoid that. And avoidance, that word, I don't like it, but that's kind of what we're doing, right? Most people are gonna push you to go through the hospital, whether it's work med surg or any other floor. For me, it's coming from me. I've lived it, I've done that, I have that experience. You can do it. You can work as a new grad in corrections. And for the people that tell you you have to go through the hospital, I mean, I took it as information of value. I think it's important. I think for a lot of people it is, but it's not a cookie cutter method of being a great and successful nurse. For me, I never worked in the hospital. Now I get to work from home. So there's other avenues. You just have to find one that's true to you. Because if you work in an area that's true to you, feels more authentic, you will have a better life, a better work-life balance. It'll trickle over. And honestly, it won't hinder you. It's not going to. You just have to find and be more creative sometimes if you're not going through the hospital. One thing you'll realize about this nursing career, I'll tell you, is one nurse doesn't know everything. So let's say you started as a new grad in a hospital, then you went to work corrections for 10 years. Well, now you haven't been in the hospital for 10 years. So does that experience really matter as much, right? You're kind of out of touch with that setting anyway. My point to it all, don't be afraid to start as a new grad in corrections. Yes, the learning curve is going to be steep, but obviously something is pulling you into that setting. So maybe that excitement, you could leverage it, lean into it, and it'll pull you through those difficult moments. And I'll tell you, if you're looking for excitement as a new grad, something different from a hospital, corrections is a great way to fulfill that for yourself. And honestly, use it as a platform to build yourself up. Like I said, I used it as a platform and I get to work from home. So this next question, friends, how do you typically apply for jail or prison jobs? So this is a good question. You know, I was in corrections for a total of 5.5 years. I've seen people use staffing companies. I've seen people apply through the actual counties and the state government websites. So those are the ones, right? You can apply through staffing companies. Oftentimes these can be through recruitment agencies. You know, maybe it's just a period of time that you get hired on for, maybe like a contract of some sort, maybe 3 months, 6 months, things like that, for specific jails, specific prisons. I'm sure if you Google this, you'll find a lot of staffing companies that will hire, you know, contracted work to go work in corrections. The other more popular one, the one that I always recommend, is getting on, you know, through the public service, right? Getting on through the county. If it's a county jail, you'll get county benefits. And trust me, just public service benefits are really good in general. So you can get on with the county, or you can also, if you're trying to work at a prison, prisons are more state provided. So those are going to be through the state government. So here in California, when I've worked in the prison system, I worked for the state of California. When I worked in the county, I actually worked for an actual company. It wasn't a staffing company, but it was WellPath. WellPath is a very popular one, I think throughout a couple states. I know here in California, and I recommend them. I have nothing bad to say about them. I was actually making quite a bit of money when I was working for WellPath in the county jail that I worked at. When I went to the prison, the pay was still honestly really good here in the state of California, but it was the benefits. It was the benefits that attracted me to actually work for the public service department, the state of California. In recap, staffing companies is an option. Google them. County jail websites, look on the websites for jobs, and also the state of California website, which is CalCareers. If you go to calcareers.com, and I imagine if you're in another state or wherever you are, just look up the big name prisons, nursing jobs, right? And I'm sure you'll find stuff. The benefit I will say is staffing companies, because they're contracts, it's a great way to get your toe in and kind of just feel the water. That's what I tell people oftentimes when they ask me, specifically about this. The contract's not a bad thing. It's a way for you to test to see if you like corrections. If you completely hate it, well, it's only a contract. You're not stuck there. You're not hired permanent full time. So for this next question, friends, how are shifts structured? So this is the one similarity that, in a sense, the hospitals have, like a jail, like a prison. It's this idea of being a 24/7 hour operation, right? Never closes. Hospitals, you have knock shift, you have day shift. From my experience, what I've seen in both settings that I've worked at, county jail and the prison, they go by knock shift, day shift, evening shift, or however you want to break it down. But they have 3 watches. That first watch, which is knock shift, that's like, I'm giving you the examples from the prison, 10 p.m. to 6 a.m. They have second watch, which is day shift, that is 6 a.m. to 2 p.m. And then they have third watch, which is evening shift, that is from 2 p.m. to 10 p.m. So it's a 24/7 operation. As a nurse, it is that way for you. The officers, the nurses, those are the personnel that stay there the whole time. You have administrative staff, similar to the hospital. They work a very fixed schedule, right? And they're not there in the evenings and overnight. But as far as nursing goes, you're there all the time. You have nursing staff there all the time. When I worked at the county jail, it was very similar to this, give or take, a few adjustments in terms of the hours, right? From each watch. Overall, 3 watches, 3 different 8-hour chunks. So what do they ask at an interview? What are some examples? So this is a good question. I really get this pretty often. Oftentimes they're gonna ask you scenario-based questions. They're gonna ask you questions in a way where they're trying to see if you're thinking about safety first, making sure a scene is safe first before you get into it. Safety is a big thing when you work in the corrections. Officers are there to keep you safe, but if you also put yourself in harm's way, often, if at all, at any moment, you're making everybody's job harder. So think of, during these interviews, that big aspect of safety. They want to make sure that you understand this, right? This environment that you work in. You want to make sure you're aware that it is a dangerous environment. One thing I'll add here is when people reach out to me about this, I've created this, document in terms of potential questions they tend to ask about scenarios. So if you're interested in that template, email me, I'll give it to you for free. It's not well made or anything. It's just something I've made for one person, and I've just sent it out to multiple people since then. But it's scenario questions in terms of what they may ask you and what you should do if an inmate presents with chest pain, an overdose, a seizure, abdominal pain, diarrhea, headache, things like that, right? Suicidal ideation, if I didn't say that yet. So these are different types of scenario questions that they may ask you. And yeah, if you're curious about some ways to answer that, reach out to me, I'll give you that template. I can make a whole video on that, but it's probably easier if you just email me, I give you that template. I got you guys. So for this next question, did I prefer working at the county jail or the prison? That's a tough one. I've enjoyed both settings, if I'm fully honest with you. The county jail, I thought of it as a place with a lot more excitement, a lot more new, a lot more unpredictability. A lot of my stories came from there, working intake. Intake is its own beast. So if you're someone who's like looking for a little bit more ER, action, excitement, spontaneity, you're like, when I go to work, I absolutely don't want to know what's gonna happen. I just wanna be blindsided and excited and on my toes, and I want my shift to go fast. Work intake in a county jail. Not to say in a prison, it's not like that. In a prison, you can work like a triage team unit, which is like a little mini ER, and there's just as much excitement dealing with the things that you see, right? Like stabbings, overdoses, like there's plenty of ways to get that cup filled. And in the jail, same way. In the prison, they also do sick call. So it's like, there's very routine, mundane, the same thing over and over again, type of work in both settings. But I think when it comes down to which was my favorite, just looking back at my correctional career, it's very difficult. I'm very torn. Prison itself helped me advance my career more. There's a lot more working opportunities. So for career advancement type of stuff, I would say the prison. The prison's ultimately what helped me have this job, because I worked in appeals, I worked case management, I worked as a specialty telemedicine nurse, I worked in the clinic. Like, there's so much there, right? It's its own little world in a prison. In a county jail, it's just intake for the most part, and then sick call. You make more money there. I made more money working in the county jail. Not to say the prison didn't have overtime, so I could have made even more money, but it's hard. I would say to get me to where I am today, here, working from home as a nurse consultant, I would say the prison. The prison was my more favorite of the two and my more balanced of the two. When I worked in the county jail, I found myself changing in a different way than I changed in the prison. You know, I wasn't going to Walmart's. I was worried about putting gas at gas stations in the nearby cities. In the prison, I didn't worry about that, right? Because these inmates weren't getting out for years, decades, or at all. So I'd say the prison, with the benefits and things like that of being a state worker, made that job better. So there, I gave it to you. What are coworkers like in that environment, right? Working corrections. It's a very good team camaraderie, a very good team unit to work with, 100%. Sure, there's a couple bad apples, you know, some people that maybe have changed for the worst, just because they've been there that long, or maybe they also have work-life issues going, and then they're working in that environment, so it does take a toll, you know, and you kind of get swayed over time, right? After seeing inmates and their behaviors, you know, it can really change you. So apart from a couple bad apples, there's been a couple in either place that I've worked. Same thing that you see anywhere you work, right? In a clinic, a hospital, a unit, a specialty, like you're gonna find that. If anything, it's always a tight group. People are always very willing to help. I always recognized, you know, newer people coming in, and I've always wanted to help them, put myself out there to really help them onboard and learn. Same thing that I do here in these videos, right? Trying to help create this series for newer nurses going into corrections, not knowing what to expect. So expect this type of energy. I think people are always excited. You know, your coworkers are always excited to see new nurses coming in, because corrections is always short-staffed, just to be frank. It is. It's not cut for everybody. Some people go into it and a lot of people leave, and very few people stay. It's a tighter group, right? So whenever things hit the fan, you know you have a good team and everyone's kind of there with you, ready to support each other. So I've always enjoyed my coworkers. One aspect I'll mention is I've always enjoyed the seasoned veteran coworkers very much, because they've always carried that energy, right? In terms of wanting to help the newer nurses coming in, they have all this experience, they just want to help you. So that's always been my experience. It's always been good. So how was it working with inmates? It wasn't as bad as I thought going into it initially for the first time. When I was going into it for the first time, I didn't know what to expect. Honestly, I was probably more worried and hesitant and nervous about working with inmates, right? Knowing that they're in there for having committed a crime, right? Or doing things illegally. And also not knowing the specifics, right? Oftentimes I wouldn't look at each inmate's crime history. Very rarely would I ever know. It would often be people telling me about it because of what they've heard and things like that. So for me, at the very beginning, I was a lot more nervous. Over time, I saw these people just as I saw a patient, you know, in a hospital or my clinical rotations, like anywhere else. Because you realize they treat you with respect as long as you treat them with respect. Respect is a big thing in prison. Honestly, too, very thankful of the work that you do, being medical in there. They actually see you, you know, in high regard as a trusted professional. Sure, again, like with coworkers, you're gonna have some bad apple inmates, and they're gonna remind you, you know, of the setting that you work in, because they're going to be disrespectful, because they're angry, they don't want to be in there. And you can kind of recognize that as, well, that makes sense, right? It makes sense to be that angry. It makes sense to be, you know, worked up like this. You're in prison, you're in jail, and that's only a few. The majority are very respectful and will always treat you with respect and high regard. Working with inmates has always been a very positive note in my experience working corrections. Once you get past that nervousness of, oh, here's an inmate, you know, here are handcuffs. Like once you get past that, you'll realize it's just a human. You'll actually enjoy it. I really enjoyed working with inmates. It was a very sad day for me when I left. It was very bittersweet because I was leaving, and I felt like I was leaving some connections that I had with, you know, frequent inmates I would see in clinic and, you know, for medical things. That's my response to that. So this next question, it's one I've gone a few times, is, you know, do I ever feel like I have to put up a front or a mask, like be more serious when working with inmates? When I was going in for the first time, I had this same question too, because that was my thought process, is that you can't like joke around, you can't be funny, you can't be, you know, kind. You have to kind of always be serious. You got to put this mask on. For me, I would always be very professional working in that environment. And by that, I mean very consistent, right? I wouldn't be the one that jokes around with this inmate and not with this inmate. I would be professional. You know, I would keep a professional tone. I'd be very respectful. And then I would joke around a little bit, right? I wouldn't be serious all the time. I'd be professional. And that was my demeanor. Some people's demeanor was joking around with this inmate, not with this inmate. And like everybody has their own style. It worked for those people. Some people were joking all the time, right? To keep the mood light and happy, right? And that was their style and that worked for them too. So one thing I noticed though, despite whatever style people have, is you can flip to being serious at any moment, because that is a serious environment. You know, I think as long as you can do that, as long as you're consistent, those are the things that matter most. You'll find your style. For me, I'm very professional. When I'm working, when I'm off the clock, I'm a lot more relaxed. So you can see the shift in my mood, and some people are just chill and easygoing and happy all the time, right? So you find your style, it all works. The one thing I would say is just don't be disrespectful, and everything else tends to be okay. So this next question is, how is it working with the jail or prison doctors? So I'll break it down, you know, from my experience in both settings. The doctors are there during the day, and then at night shift, they're on call. And it's been like that in the jail that I've worked at and the prison. Both have had the doctors there on site and easily accessible. The jail had one doctor, one main doctor, and a couple other, you know, like nurse practitioners, other mid-level providers. So the jail was kind of its own structure, but at night they were on call. In the prison, they have a clinic. They also have like a mini ER. So there's a lot of doctors, a lot more than in the jail. And when they work the mini ER, that doctor is available for any phone calls throughout the facility. No doctors at night, but they can get called in to come in, you know, to the prison, to the jail. If not, you know, they're there during the day. So that's kind of like the relationship with the doctors. Anyone who works in healthcare, in corrections, has like a different perspective, right? They know that this situation, this environment is unique. So you always kind of bond over that. And my relationships with the doctors have all been really good. They've all been really chill. You know, there's some really chill doctors, a little bit more professional doctors. So it's the same thing like in a hospital, I would say. It's not much different. Yeah, I mean, everybody has their reason for working corrections, just like you will as a nurse, just like I have. The doctors are no different. So yeah, you know, for the most part, no difference. So what other healthcare treatments do jails or prisons have? So when I think of healthcare, you know, I think of all the healthcare services. You know, they have dental services provided there as well. So they have dentists, they have dental hygienists, they have dental assistants. You know, they also have pharmacy. They have a pharmacy there where inmates can go and pick up meds, or, you know, process the meds for the nurses to give and the doctors to give, or be around for the doctors to ask questions to. They also have mental health services, right? They have like therapists, they have psychologists, they have psychiatrists. You know, they also have like administrative and social services too, as well. Those main three that I mentioned, those are the main services apart from nursing and medical that they have. We're making our way through these questions. I'm surprised you guys are still sticking around. I drink black coffee, by the way, but I need a little break there. So two more and then we're done. So friends, this next question, this one's one I've gotten a couple times too, especially when I speak to the females that are interested in correctional nursing. And I think it's important to mention, and this is honestly a very valid and very important question. As a female RN, will you garner a lot of attention in corrections? To be blunt, to be frank, yes, you will, especially in a male prison and jails. You know, they have females and males there. But just in general, yes, as a female, you will garner more attention, and more so in a male prison, a male environment, right? And this will go the same way for officers and inmates, right? A lot of male officers, if you're going to work in a correctional environment specific to the male population, male inmates. And I will tell you, I'll be honest, you know, oftentimes the majority of it is very respectful, but it is still attention. So it's just a matter of how that makes you feel. Another thing I'll mention is just that environment. you'll be surprised, most medical staff is actually females. I always thought going into it I would work around a lot more male nurses or male medical staff, and that just wasn't the case. You know, there's quite a bit of female doctors, and then most of the nursing staff is actually female. From my experience, just with walking in and out, you know, with female coworkers and colleagues, you know, they just say hi to you. They say hi to you, they don't say it to me. You know, and that's the attention, right? They just want to kind of talk to you and get you to notice them. And most of them will be respectful. I've even seen situations where like I couldn't, you know, get through to an inmate. Here comes a female nurse. She speaks to that inmate, and the inmate follows direction, follows through. You know, take that how you want. That's just things that I've observed. So there's good things about it, there's bad things about it. Do you get more attention? Yes, you will. Just to be honest, and just so you know that information. And this last question, friends, this is the very last question, at least for this series here. I know this video has gone on for a little bit. I'm not sure how long it is, but we can do another part if you guys want more. What are the most common RN skills used in corrections? So the most common one is head to toe assessment. So you can think back to nursing school. Oh, you know, my head to toe, I do it this way, that way. And yeah, you're just gonna have many opportunities to practice in the correctional setting. Head to toe and then focused assessments are the two most things that you use in that environment. So you will always start with the head to toe on any inmate because they're gonna come to you with an issue, and then it's gonna go to a focused assessment. Those are the two main that I've seen. Working the clinic, working the mini ER, working the infirmary. County jail is the same thing, you know, working intake, working sick call. So those are the two biggest skills that you use. As far as like actual like skill sets, like physical skills, in the jail not as much, in the prison more so, you know, starting IVs, you know, catheters, changing, you know, the dressing of a PICC line, things like that. In both settings, you know, giving subcutaneous medications, IM injections. So, you know, a lot of medication passes, oral medications, right? Nothing too intense. The other thing I'll say is part of those focused assessments is, you know, ER, right? Emergency, almost like medic, initial treatments, right? Like stabilization of patients. So oftentimes, like in both settings, whenever you respond to a medical code, which is like a man down situation, right? Which is when an inmate's calling for 911 in that environment, like there's no 911 for them, so they call a medical code. You don't know what you're gonna walk into. So a skill to have, and you're gonna practice those over time by being in that environment, is kind of putting on this medic hat, going to these environments and seeing if the scene is safe, right? First and foremost, but then treating, stabilizing, further identifying what's going on with this inmate. Medic type work, EMT type work is also part of it. You know, they train you in all of that when you're working in both settings. You know, spinal immobilization, you know, identifying bleeds, applying pressure to hemorrhages, you know, NPAs, OPAs, administering Narcan, things like that, right? Think of all of that in a term, umbrella term of being a medic or EMT. So the skill sets involved with that, they train you in that too. And I think that's it. Some of the most that I could think of for now. So that's gonna be it, friends, for this video. I don't know how long this was, but I hope you were able to enjoy it. Like I said, frequent this video, use it, look for the timestamps down below if there's a specific question you ever want to come back as a reference to. And as always, you know where to find me, Male Nurse Mentor on Instagram, and my email, I think I was putting it throughout the video, but it's support@californiaprenursing.com. If you like this video and you want to see a part 2, leave a comment down below, or if this video gets enough traction, enough likes, and you know, I want to make another one, I'll make another one. So I'll see you guys around, friends. You know where to find me.